Clinical manifestations, history and demographics. Billy Boulders is a 62-year-old man who has recently been diagnosed with autoimmune thyroiditis, or Hashimoto's disease. He has a history of high cholesterol, atherosclerosis, and is obese. His vital signs and emission are respiratory rate 12, heart rate 50, temperature 36, and blood pressure 105/69. His medications include atorvastatin, 40 mg orally daily, levothyroxine, 25 micrograms orally daily. He describes that in the past 2 weeks he has been extremely lethargic and tired, and as a result has been calling in sick to work as he feels he cannot complete a full day. He has also withdrawn from lawn bowls as he does not have the energy to play. Billy reports feelings of numbness and tingling in his fingers, loss of hair, and has described his throat as full. He complains of being cold even when the environment is warm and has dry and pale skin. He has also been struggling to go to the toilet. He is growing increasingly anxious and wants to feel better. Billy's wife has reported that he has become confused, forgetful, and has slowed speech. She is scared that he is experiencing early signs of dementia. She also has noticed that he's gained around 7 kilograms in the past few months with no drastic change in their diet. Recommendations. Due to Billy's symptoms present and his recent diagnosis of Hashimoto's disease, the care team should investigate further into issues involving Billy's thyroid. The Australian Thyroid Foundation recommend diagnosis using biochemical testing, including serum TSH, T4, T3, and thyroid antibodies. A thyroid ultrasound is also important to determine the structure of the gland and any abnormalities within the gland. In particular, the collaborative team should ensure Billy undergoes blood tests for thyroxine, or T4, and a total T4 will be needed initially and ongoing to monitor thyroid replacement hormone levels in the blood. A total T4 measures the total amount of thyroxine in the blood. This includes the amount attached to blood proteins that help transport the hormone throughout the bloodstream. NSQHS Standards. Standard 4. Medication Safety. All nurses involved in Billy's care should dispense, administer, store and monitor his medication in a safe and responsible way by following the mechanisms and procedures in place at the healthcare facility. The nurses should accurately record the medication history throughout Billy's care. This history and new information about Billy's medications should be handed over to other staff and related healthcare professionals. In accordance to Billy's right as a patient, he should also be informed and educated about the medications he has been advised to take and his key responsibility in adhering to the medication plan. Standard 8. Prevention and managing pressure injuries. During Billy's stay in hospital, just like with any other patient, the nurses should follow the system in place for the prevention and management of pressure injuries. This is particularly important as Billy is an obese, older adult, which are both risk factors for developing pressure injuries. Consequently, the nurse may take particular care to remind Billy to change position or utilize pressure-relieving tools such as an air mattress. Standard 9. Recognizing and responding to clinical deterioration in acute health care. Although Billy is not in a critical state, it is still important to ensure any deterioration in his condition is recognized promptly and an appropriate action is taken. Billy and his family should also be educated about recognition themselves in order to escalate care if needed. This includes monitoring and providing ongoing treatment for Billy's Hashimoto's disease, high cholesterol, and atherosclerosis.
Hashimoto's thyroiditis and hypothyroidism. The most common cause of hypothyroidism results from autoimmune destruction of the thyroid gland. This then leads to an individual developing Hashimoto's thyroiditis. Pathophysiologically, this means that antibodies are sent to the thyroid antigens, and the inability to infiltrate cytotoxic T cells leads to the destruction of thyroid tissue. As Hashimoto's thyroiditis progresses, it will eventually lead to the development of hypothyroidism. The symptoms of hypothyroidism result from decreased metabolic rate. Patients may gain weight, feel sluggish and cold, and initially present with slowed heart rate. Billy Bolt, 62 years of age, who has been recently recognized with the condition of Hashimoto's thyroiditis, presents with all initial symptoms that link his condition to hypothyroidism.
Pathophysiology. When understanding how hypothyroidism occurs within the body, we must address the hypothalamic pituitary thyroid axis. The thyroid gland is influenced to secrete hormones by two other organs, including itself. These are the anterior pituitary gland, which produces thyroid-stimulating hormone, also known as TSH, and the hypothalamus, which produces thyrotropin-releasing hormone, also known as TRH. Low levels of thyroid hormones in the blood are detected by the hypothalamus and the pituitary gland. This causes TRH to be secreted, therefore stimulating the anterior pituitary to release large amounts of TSH. Increased levels of TSH stimulate the thyroid to produce more thyroid hormone, attempting to return the level of thyroid hormone in the blood back to within its normal limits. The HPT axis controls the release of thyroid hormones triiodothyronine, also known as T3, and thyroxine, also known as T4. Hypothyroidism is the most common type of thyroid dysfunction. Hypothyroidism is the unavailability of required levels of thyroid hormones to maintain a normal metabolism. This endocrine condition occurs in a number of pathophysiological states. These are as follows: deficiency within the thyroid gland, a lack of sufficient iodine in one's diet to produce required levels of thyroid hormone, insufficient functioning of the thyroid tissue due to an autoimmune disorder, lack of thyroid-stimulating hormone due to pituitary disease, or lack of thyroid-regulating hormone due to disorders of the hypothalamus. Written in the literature of Brown, Edwards, Seaton, and Buckley, hypothyroidism can be defined as the deficient production of thyroid hormone by the thyroid gland. Disorders associated with thyroid hormone secretion and functioning are second only to diabetes mellitus as the most common endocrine disorders. Primary causes of the disease include congenital defects, inadvertent loss of thyroid tissue, and defective hormone production as a result of comorbid thyroiditis, iodine deficiency, or antithyroid medication. In Mr. Bolt's presentation, it is clear that his comorbid thyroiditis is the link that requires for the diagnosis of hypothyroidism. As we go into more detail of the progression of the illness and each stage of this condition, it is evident that the body and its systems are severely impacted from inadequate balances of thyroid hormone. Written in the literature. When addressing hypothyroidism, we are looking at it as being classified as either primary or secondary. In primary hypothyroidism, loss of thyroid tissue through destruction of the thyroid gland causes decreased production of thyroid hormone and therefore increasing its secretions. The most common cause of primary hypothyroidism is atrophy of the thyroid gland as an end result of Hashimoto's thyroiditis or Graves' disease. Comorbid conditions such as acute and subacute thyroiditis, autoimmune thyroiditis, painless thyroiditis, and postpartum thyroiditis each play a role in a patient developing primary hypothyroidism. Secondary hypothyroidism is a result of pituitary disease and the failure of the body to synthesize inadequate amounts of TSH and TRH secretions. In the beginning of the presenting illness, the patient will be at risk of irritability, complain of fatigue, and go through periods of feeling drowsy.
As the condition progresses, the central nervous system is attacked, with mental processes becoming dulled and emotional responses subdued as speech becomes slow and deafness is accompanied. Once illness changes from dormant to progressive, patients may present personality and cognitive changes like the similar characteristics of a dementia patient. This is where assessment of patients should be thorough to rule out comorbidities and determine the correct diagnosis. As the progression continues, each of the body systems begins to be targeted individually. Pathophysiological conclusions. Stated pathophysiology allows for a diagnosis to be made that Billy Bolt is presenting with primary hypothyroidism. His conclusion can be drawn from his previous history of Hashimoto's disease, but also symptomatically his presenting state. Mr. Bolt has recently gained 7 kilos, which can be explained by his decrease in metabolic rate and his sluggish fatigue and inhibiting his functioning in everyday activities such as regular work and playing warm balls. Mr. Bolt's recognition of his body temperature of feeling cold, although incorrect temperature, highlights the insufficient functioning of his thyroid gland to maintain controls in homeostatic temperature. The presentation of pulse rate of 50 beats can conclude that his condition is hypothyroidism, as usually his pulse rate should be elevated due to his history of increased cholesterol levels and atherosclerosis.
Hi there, my name is Dylan and I'm doing the medication part of this PowerPoint. First drug I want to talk about is called thyroxine, otherwise known as Urosig or Oroxime. This is used in thyroid hormone deficiencies. It works by being converted into an active form of T3 within the body, which is a thyroid hormone, and therefore it increases the metabolic rate by mimicking the hormones that thyroid gland usually creates. The contraindications of this, it will impact upon Billy Bolt's atorvastatin medication for his high cholesterol, as when his metabolic rate increases, it may mess with the dosages and the effect on his body. Side effects include nervousness, anxiety, irritability, sweating, flushing, headaches, tachypnea, tachycardia, and cardiac arrhythmias. These are all usually associated with overdoses and therefore mimic hypothyroid symptoms. So when their metabolic rate increases, obviously there's a lot more reaction going on in the body, so they're going to lose more weight. Tachycardia, tachypnea also related with that, and also they're going to start getting a lot more hot because there's a lot more reactions going on in the body. Some considerations when giving this drug, you want to make sure that due to Mr. Bolt's high cholesterol, you want to monitor any cardiac distress. As we talked about before, as his metabolic rate increases, oxygen demand for the heart and the muscles is going to increase as well, therefore exacerbating any underlying heart problems. Also, if he does develop any cardiovascular problems in the future, his medication may need to be adjusted, both for the atorvastatin, any other medications to do with his heart, and also the thyroxine. Now, lythronine, also known as tetroxine, works in a very similar way to thyroxine, which we talked about previously. However, it's much more potent and has a much faster onset. Therefore, it is only used in cases of acute severe hypothyroid states or myasthenic coma. Now, Mr. Bolt wouldn't require this medication right now. However, if his case did deteriorate to the point that he did present with an acute hypothyroid state or did fall into a myasthenic coma, this medication would be used. Now, a myasthenic coma results from the accumulation of mucopolysaccharides within the interstitial fluid. This is usually because of the lower metabolic rate, because of the hypothyroidism, doesn't allow for the breakdown of these compounds, allowing them to gather and form an edema. Now, contraindications for this medication, if a patient does develop any cardiovascular diseases in the future, this medication cannot be administered. So in Mr. Bolt's case, he has a high cholesterol, so he can currently have this medication. However, if we do find any cardiovascular diseases in the future, this medication cannot be administered. We also need to pay attention to his atorvastatin medication he's on, as once again, when his metabolic rate increases with this medication, the dosages will have to change and the effects on his cardiovascular system will need to be monitored. Now, the side effects of this medication, They mimic hypothyroidism because they usually only occur in cases of overdoses, so such as sweating and excitability, restlessness and flushing. This is because of the increased metabolic rate. Same with excessive weight loss, anginal pain, tachycardia, cardiac arrhythmias, palpitations, skeletal muscle cramps and/or weaknesses. Now, some nursing considerations for us to keep in mind is that we need to monitor the heart rate closely. Once again, as the oxygen demand increases, as the metabolic rate increases, this can exacerbate some underlying heart conditions. So therefore, we need to report any tachycardia and palpitations. Now, if Mr. Bolt did fall into a myocytic coma, if he presented with a deteriorated case of hypothyroidism, we will also need to require ECG monitoring, ventilation, and also the use of corticosteroids. The next medication I want to talk about is called NUR2106. Now, this works very similarly to thyroxine. However, it's more tolerable by people with allergies as it comes from actual desiccated pig's thyroid, which means that it's dried out, rather than using some of the synthetic ingredients used in thyroxine. Some of the contraindications of this are, once again, since it works similarly, you ought to manage the atorvastatin as the basal metabolic rate increases. And also with the side effects, they're pretty much exactly the same as thyroxine. So they're usually associated with overdoses and therefore mimic hypothyroid symptoms such as nervousness, irritability, sweating, not being able to tolerate the heat, tachypnea, tachycardia, things of this nature. In the extreme cases, thyroid storm, hyperexia, coma, and death can result. However, these are usually very rare and usually occur with very large overdose or if another comorbidity coincides with it. So considerations of this are, once again, as the metabolic rate increases, due to the high cholesterol and also the age and weight of Billy Bolt, we want to make sure we're monitoring his heart or cardiac health. And also we want to make sure that we're managing any of the medications if he develops any cardiovascular problems in the future. An extra consideration with this drug is to be aware of any cultural sensitivities regarding the use of animal products in the medication, whether it be religious, whether it be dietary. You just want to make sure that they're aware and that they get the choice of saying, well, no, I would rather not give it a thyroxine sort of thing. The last medication I want to talk about is iodine supplements. Now, iodine is crucial to the synthesis of thyroid hormones within the body, and since our body cannot produce iodine naturally, we rely on our diet for it. Now, if a person does not have enough iodine in their diet, iodine supplements can be provided, however dietary changes are most preferred. Now, contraindications of this medication are obviously if the person does have an allergy to iodine, and if you're unsure if they have an allergy, make sure to monitor them when you first give them the medication. Some side effects of this medication include nausea, stomach pains, headaches, runny noses, metallic taste, or diarrhea. However, these are extremely rare. Some of the considerations is that, once again, due to Mr. Bolt's high cholesterol levels, once his thyroid levels start to return to normal, we want to make sure we keep an eye on his cardiac health, as oxygen demand will increase, as the metabolic rate starts to stabilize, and therefore could exacerbate any underlying cardiovascular problems. Another thing we want to watch out for is diet, whether or not they're vegan, whether or not they have some sort of cultural sensitivities to some of the food they eat. We want to make sure that they're getting the right amount of iodine. And if they're eating high amounts of iodine, this can also be a problem, and therefore we wouldn't want to provide iodine supplements.
Monitoring thyroid-stimulating hormone and iodine levels progressively allows the healthcare team involved to initially confirm the existence of hypothyroidism, and throughout the progression of care, to monitor the effectiveness of treatment that is being applied to the patient. Ultimately, screening TSH levels through blood tests in appropriate frequency will aid the care team in making clinical decisions about further treatment pathways. Screening of iodine levels is critical in managing the thyroiditis condition, as iodine is a crucial nutrient for thyroid function, which forms the backbone of thyroid hormones. Therefore, regularly monitoring his iodine levels would aid in stabilizing his condition. Iodine levels can be measured by urinalysis, preferably in a 24-hourly routine for frequent screening. These health screening methods would be collaboratively carried out by physicians. Management of persistent symptoms of hypothyroidism is another type of nursing intervention. Common manifesting symptoms of hypothyroidism include chronic stress, imbalances in body temperature, ineffective breathing pattern, and disturbed thought processes due to above factors, and depression, possibly leading to inactivity and risks of pressure injuries. In aiming to counter these clinical symptoms, the nurse could act to accommodate and relieve all patient needs and promote a comfortable environment by addressing the following. As chronic stress causes hormonal imbalances in the body by causing depression of hypothalamic and pituitary gland activity, the nurse could aim to relieve the emotional tension through therapeutic conversation with Billy and guide his daily activities in a way that he would not be placed at the risk of being emotionally irritated, so that his stress mechanism can both be relieved and left unprovoked. For fluctuating or abnormal body temperatures, the nurse could provide an extra layer of blanket to minimize body heat loss and rigorously monitor Billy's decrease in body temperature in comparison to his baseline to ultimately maintain his normal body temperature. Ineffective breathing patterns can be managed by continuously checking Billy's respiratory rate, depth of breathing, the pattern, and by encouraging deep breathing and making use of ventilatory support to prevent any respiratory depression. For possible pressure injuries, Billy could be assessed by the nurse for the risks of pressure injuries due to his inactivity and be provided with prevention and management strategies which are adherent to hospital-specific framework, such as changing patient's position every couple of hours. As another form of nursing intervention, managing Billy's dietary intake in collaboration with a dietitian can be effective in improving and maintaining his TSH levels. Avoiding goitrogenic foods in Billy's diet can assist in improving overall thyroid functions, as goitrogens decrease the uptake of iodine by the thyroid gland, an essential component of thyroid function. Specifically, the dietitian can monitor the intake of foods that include soy, sweet potatoes, cabbage, broccoli, cauliflower, kale, and collard greens, and aim to increase the ratio of foods that contain iodine in Billy's diet plan. Lastly, focusing on the effectiveness of medications that are given in treating the hypothyroidism would be critical as an intervention. As thyroxine, liothyronine, and iodine supplements have been prescribed for Billy's condition, monitoring the medications, dosage, side effects, and drug interactions diligently would be significant in improving clinical outcome. Adjusting the dosages by observing the change in the persistent symptoms, side effects, compliance, and absorption of the drugs minimizes the risk of undertreatment or overtreatment, depending on the response of the patient's body to thyroxine and the other medications. Preventing and managing any negative drug interactions is just as crucial to prevent any further clinical complications from arising and to maximize therapeutic effect.